Okay, a very good evening, everyone. Okay, I'm your host today for our topic presentation. I'm Dr. Ramesh and our co-panelists, Dr. Shalini, Dr. Ruban, and Dr. Hannan. Our topic of
Hi.
presentation today is it's doctors during the COVID-19 pandemic. What are their duties and what is owed to them? Okay, so an outline of the contents. As a brief introduction, the World Health Organization declared coronavirus disease 2019 as a pandemic on the March 11, 2020. The contagion since then has ushered endurance and perplexing times globally. The requisite responses such as quarantine of entire communities and social isolation has abruptly changed daily life. The major concern has been preventing the spread of infection with the focus of personal protective equipment, modifying policies, and also workflow regarding the management of suspects and confined cases, bolstering intensive care services, and providing emotional and psychological support to healthcare workers. The professional bodies did expedite their efforts to identify the challenges and also modifying the existing guidelines to promote safety and healthcare providers and society in general. The central and state government also took note of the situation and formulate policies and amendments the existing laws. Doctors form an essential part of an effective response towards the COVID-19 pandemic. They have critical roles in diagnosing, containment, and treatment, and their commitment towards treating despite increased personal risks is essential for the successful public health response. Despite this, traditional public health ethics has paid little attention towards the protection of the rights of the doctors. During the pandemic, it presents an autonomy challenges not only for the patients, but also for the healthcare workers in the medical premises. On the other hand, interpreting autonomy in a positive way would probably entitle everybody to any treatment requirement, irrespective of medical advice or conflicting claims for scarce resources. A positive viewpoint of autonomy would, however, be often seen as incompatible with the ethical principles of non-maleficence, justice, and the practicalities of healthcare services, especially during the pandemic. So what are the duties, whether the doctors have a duty to treat in diseases, outbreaks, and pandemics such as COVID-19? With respect to the moral theory during the pandemics, claims about the duties of doctors are often grounded in so-called special duties or role-related duties. In other words, by virtue of their profession, doctors have a more stringent obligation of beneficence than most, and they have obligation towards their patients as compared to other specialty. However, it seems clear that the duty to treat cannot be absolute, that doctors have a duty to work regardless of their circumstances, and they have a right and protection and to care during an infectious disease outbreak as do as other members in society. It is also pointed out that in time of crisis, their duties derive from doctors' multiple roles, where often come into conflict, and their problems with many accounts of duties of doctors is that they fail to acknowledge this tension and to consider workers as multiple agents belonging to a broader community. So what are the special circumstances? The 2003 SARS epidemic provided some important insight into the experience and pressures on healthcare workers during the epidemic, as well as highlighting some of the important gaps in ethical thinking and also practice. Many of those who treated patients with SARS raised concerns about the protection that were provided to safeguard their own health and that of their own family. Some refused to attend SARS ward, resulting in permanent dismissal, and some choose to leave the profession post-pandemic. Notably, it was recognized during the SARS that there is no consensus as to how implicitly and stringent the requirements for duty to care should be stated. Scholars recommended advanced planning with local and national professional medical association to obtain agreement about the extent of professional obligations during the pandemic. But almost 2 decades later, this remains little consensus and clarity over the reasonable expectation of the medical workforce. So what are the basic duties? Doctors must consider the patient's medical history and also presenting symptoms, as the patient may be having long duration of symptoms or conditions where related to the pandemic or pre-existing illness. In a case of Chin Kiao versus the government of Malaysia in 1967, Doctors must ask the patient relevant questions and listen to his or her account of illness, as in the case of Marini versus Midlands in 1984. In cases of doubtful diagnosis, it's good practice for the patients to be referred to a specialist for further consideration of a case, in a case of Gordon versus Wilson in 1992. So the duty of diagnosis is always an issue during the pandemic, and error of diagnosis will not necessarily amount to negligence unless the patient can establish that the doctor failed to carry out an examination or a test which is the patient's symptoms called for, or his or her conclusion was one that no reasonable competent doctor would arrive in the area of diagnosis. And if those elements are absent, then it proves negligence during the pandemic, where the absence of duty of care, the breach of duty, and causation or consequential damage may occur. So next, I would like to invite Dr. Shalini to give an input on her side. Thank you.
Okay, thank you, Dr. Ramesh. I will be touching some on duty of care and opting out to treat patients. So there are many obligations to treat patients during a pandemic according to what society thinks. Various literatures are available on physicians' ethical obligations to treat during pandemics, but much less has been written about their legal obligations. Without understanding the legal landscape, physicians could face serious professional and personal consequences. So what do we understand by legal duty of care? The law is settled that a person should take reasonable care to avoid acts or omissions that she or he can reasonably foresee as likely to cause injury to the other person. This is known as the neighbor's principle. Neighbor here means the person closely and directly affected by my act, as per Lord Atkins. So, legal duty of care provide a certain standard of skill and care to their existing patients. It also comprises several catalog duties, for example, diagnosing, treating, and if it's beyond their specialty, they should refer the patient and also advise the patient where it needs. In a traditional view, physicians owe a duty of care only to their existing patients, even in an emergency. So to whom these duties apply? All doctors have a duty within their limitations to care for their patients, but an acutely unwell and infectious patient might not be within the normal range of practice of some doctors. Is opting out justifiable in this case? Why do doctors opt out? There may be many reasons. For example, they may have limitation of resources. For example, in the COVID-19 pandemic, we need a lot of PPEs, social distancing, the isolation room, and some doctors may not have all this in their facilities. It may also be morally justified in opting out of frontline work if what they reason out is justifiable. Their reasons can be easily justified if this frontline work extends beyond their area of expertise as well, and or places a significant personal or physical burden on them. So when these doctors move out, it places an additional burden on their colleague. For instance, an older doctor with diabetes may object to moving to frontline COVID-19 work, given the suggestion that a higher mortality is associated with COVID-19 infection in those who are older or have comorbidities. So the health risk refused by one individual is left to be absorbed by someone else. According to the Boehm's principle, a doctor is not guilty of negligence if he has acted in accordance with the practice accepted as proper by a reasonable body of medical men skilled in that particular act. But then there are medical opinion which differs from this Boehm principle. For example, in the case of Hunter versus Henley, the substantial deviation from normal practice may be warranted by the particular circumstances of a case. However, in Malaysia, there's a need to act according to our own guidelines, but it must be logical, as what the Boliter addendum requires. In the case of Polk versus National Health Service Commissioning Board in 2015, it was demonstrated the need for healthcare professionals to follow relevant guidelines, even in an unprecedented situation of infectious disease. In this case, where it happened in 2009 during the swine flu pandemic, A patient was unwell and thought she contracted the swine flu. She went to her local healthcare center and was seen by an experienced nurse. The nurse examined her and advised her to return home and rest in bed. 2 days later, she was admitted to the emergency department where she suffered cardiac arrest. Though she was resuscitated, she was left profoundly disabled due to brain damage. Investigation showed she had swine flu and further complications was caused by pneumonia. So the patient sued National Health Service for medical negligence, claiming that according to national guidance, any flu-like illness to be measured as swine flu, which the medical staff should follow. So what are the differences in other countries? I will touch a little bit on Canada. Hospitals and healthcare facilities in Canada are governed by occupational health and safety statutes of each province. The provisions for the right to refuse to work because of unsafe conditions are slightly different in each province. For example, in Manitoba, a worker may refuse to work or work in particular if she or he believes on reasonable grounds that it constitutes a danger to his or her safety or health or to the safety of health officer working in that environment. It may be legal in that province, but it's unacceptable in another province. In Canada, labor boards across Canada have affirmed that workers must satisfy 4 criteria to justify a refusal to work because of unsafe or dangerous conditions. They must honestly believe that their health or well-being is endangered, and also they should reasonably believe that their health or well-being is endangered. So they must honestly and reasonably believe that. They should also communicate their concerns to their supervisor in a reasonable and adequate manner. And also the danger must be sufficiently serious to justify the action, not to treat a patient at that time. So the legal liability of medical practitioners refusing to treat patients during a pandemic differs from one country to another country, but the basic of it is whether it is justifiable or not. Thank you, Dr. Ramesh.
Thank you, Dr. Shalini, on your interesting input. Now, next I will present Dr. Ruban to give his presentation. Thank you.
Hi, good evening all. Thank you for the opportunity. So I'll be talking about what are the reciprocal obligations to doctors from employers and patients. So basically, we had a very unprecedented situation whereby the pandemic started last year, right? So it's like basically the doctors are going for war. So the least that the employers can do for us on treating the patient on daily basis is making sure that we have enough personal protective equipments. There are proper measures in place to protect the doctors and their family, vaccination for the doctors and family, socioeconomic status, meaning a proper plan and future pathway for the contract MOs, medical officers or housemen for their own future and things like that, and adequate indemnity insurance, sustainable working hours and enough rest so that we can continue the battle, and prior testing for those who already have symptoms, sufficient sick pay leave, and acknowledgement for contribution and service by employers. These type of things which will actually encourage the doctors to go an extra mile to help the patient. So this is a very vital things that the employer can do for the doctors. And how about from the patients? So it's a very thin line between doctor-patient relationship. All the while, everybody will be trying to protect the patient from the doctor, from negligence and things like that and everything. But what about the patient? What mistakes the patient that do can lead to jeopardizing the doctor's daily duties and also his family and his surrounding and everything. Like few cases that I'm going to put forward is just few of them. There's a lot of cases which happened in Malaysia during this pandemic and things like that, whereby one of the case where a lady was admitted in the hospital in Kedah for delivery failed to make full disclosure of her COVID-19 status. So after giving birth, as usual, she developed a fever, and then later found out that she lived with a family member who already have COVID-19. And at that position, she jeopardized every health worker, the doctors who attended, and everybody basically. All right, that is one case. The second case, a medical center in Malacca, who the patient didn't disclose his contact with COVID-19 positive colleague linked in some gathering, and the medical center was shut down for almost 2 weeks, non-operational, putting everybody at risk. And another one more case that I want to highlight here is like a patient who came back from Italy but did not disclose this information to anybody upon her return. She was supposed to be 14 days quarantine, right? But she ignored it. And because of this patient, about 37 people were infected, and some people, 5 of them died, and 1 of them is in critical condition and everything because she failed to disclose her travel details. So the reason why I'm talking about all these cases and everything, I'm coming back to the neighboring principle which Dr. Shalini has elaborated just now. So what about the neighboring principle in the COVID-19 situation? So put simply this, if you are a carrier of COVID-19, be it silent carrier or otherwise, other persons who can get infected by you are simply your neighbor in the eyes of law. And by them being your neighbor, you then owe them the duty of care. So by you owing them the duty of care, you are liable for any injury and damages resulted by you breaching your duty of care. So meaning, if you have COVID-19 and you didn't disclose it, and you actually infect another person, so you are actually liable in the court of law. All right. So being that let's say you didn't disclose your information, or you didn't self-quarantine, proper self-quarantine for 14 days, and you get another person infected, you are liable under the court of law. So according to Bolam and Bolito's case, Bolam versus Fried Hospital Management Committee and Bolito versus City and Hackney Health Authority, they simply say that if the doctor has negligence because of the patient did not give a proper information from healthcare, they omit some information from the healthcare professional. So because of this, a diagnosis may be not made correctly or delayed. So because of this, the healthcare professional might make a mistake on the treatment. So he or she is not liable in the court of law. And in case of Mackey versus Greenview Hospital, it was held that the patient was under duty to exercise ordinary care for her own safety in giving her medical history. But the court found in favor of doctors and held that since the medical practitioners operated with the knowledge of heart disease, so they cannot be found negligent. So these are few cases that I highlight. If the patient hide a vital information from us and we make not accurate diagnosis and the treatment might fail, so the doctor is not liable under the court of law. So the law is tried that damages can be awarded in respect of a tort or a case where there is a breach of duty of care or etc. The general aim of an award of damage is to put the injured party in the same position as he would have been in the tort had not occurred. Put simply, in this case, if you are infected by COVID-19, you will lose your ability to perform your daily duties, your business will go down, you are unable to work even from home, or your movement will be very limited since you are bound to comply with compulsory quarantine and things like that. So when you owe somebody this much of issue, it's not that they are only giving the aim of the award is not to just to get back in to settle the damage, but to put you back in the earlier position where you are not infected by COVID-19. So that is my understanding of neighboring principle and everything that I understand and everything. So thank you very much. Back to you, Dr. Ramesh.
Thank you, Dr. Ruban, on your interesting input. So next, I will present our next presenter, Dr. Hannan, on his input. Thank you.
All right, thank you, Dr. Ramesh. So what I'm going to talk about is about what should doctor do if these reciprocal obligations are not met. So where to go? So what's with the issues? So increase of the demands to treat during pandemic. the high expectation by the society that all doctors can always help during the pandemic, the misbalance in between the safety of the doctor and duty of care of the doctor, causing instability in providing care with a proper safety measurement and protection from the legal perspective. So historically speaking, nursing and doctor has seen the calling in which they are expected to sacrifice themselves for their patients. This is said by the Friedman 1988 and also Cow and Jagger in 2018. So to where doctors can turn to in this kind of matter. Unfortunately, there is no clear and defined margin on how the doctors should do or act if they perceive the obligation are not met. No government bodies yet come with a proper outline on how in handling this kind of dilemma. So in UK professional guidelines remain remarkably ambiguous as to the expectation of doctors. The apparent failure of employers and the state to meet obligation to doctors in the UK, the obligations such as shortage of PPE, manpower, and also medical instrument. So can doctors refuse if their safety is jeopardized by treating the patient itself, such as in the lack of PPE or in the inadequacy of safety environment? So by General Medical Council said, good medical practice advises that doctors must not refuse to treat patient even because the patient medical condition may put the doctor at risk. But that is all depend on available steps should or be taken to minimize that risk before providing the treatment. So this is include in escalating concern to the employers or the government in the case of lack of equipment or PPE. So issues in moral decision also give a burden to the doctor itself instead of the employers. So this will present a structural problem for doctors who may all too easily be pressured into unacceptable working condition by employers, such as overtime, overwork, and minimal safety to the patient, to the doctor itself. So the correct question is, what should the doctors do? So what they need to do is justify. So despite the circumstances, justification on reducing or limit the treatment is a must for a doctor where the reciprocal obligation has not been met. Rather than opting out treating a COVID-19 patient care role, they should consider that task-specific opt-out things, such as depend on the proportion of the obligation that is not met. So for example, if the doctor lack of supply of N95 respirator and only have a 3-ply surgical mask, that they can opt in doing aerosol generating procedure. So this they can still continue with treatment such as giving care like face mask, oxygen supply, proper and adequate medication, and also physical treatment that doesn't need the use of N95. So other example is like a surgeon who are going to do a surgery for COVID-19 patient. They are justified to refuse for surgery if the lack of safety gown or PAPR for a surgeon who having risk in contracting virus throughout bloodborne. They are justifiable to delay the surgery until the required safety precaution is fully met. So other example is justified in opting out situation is like if the patient itself is sick, the doctor itself is sick or having high risk of mortality in contracting disease. So this is examples for such as a doctor that use chronic usage of steroid medication due to his or her medical condition such as burden of autoimmune disease, or a doctor who underwent organ transplantation which required long-term steroid usage. So how about a good Samaritan deed if the doctor or healthcare worker or doctors is off duty? So in UK, there is no legal obligation in the UK for a doctor to volunteer as a good Samaritan during an emergency, but they do have an ethical obligation to provide assistance. Hence, in pandemic where risk of care is higher than usual, the healthcare provider may opt out not to treat patient in the base of Good Samaritan. So is Good Samaritan deed protected by law in UK? Yes, it is protected by the Social Action Responsibility and Heroism Act 2015, which intended to protect those acting in emergency in England and Wales from legal action. So situation in other countries such as France, they have a very dedicated Good Samaritan law which compels doctors to assist in an emergency. But this was not further elaborated and modified in the case of global pandemic or crisis. However, in China, political and custom understanding with background of communism has established the role of heroism and sacrifice. Hence, public and political expectation for the doctors to sacrifice themselves in the situation of pandemic. So in the current coronavirus crisis, they frequently liken this kind of situation where the healthcare provider without adequate supply of PPE is like sending a soldier into war without gun. So on 27 February 2020, WHO DG called all the countries to prioritize the protection of healthcare professionals during COVID-19 outbreak, because across globe's clinicians and frontline workers have not been given adequate equipment they need to be safe, and many have died because of the result. So my point of view, there should be a guideline and judicial law made specifically in duty of care when the danger of the healthcare practitioners exists. Option to opt out if reciprocal obligation not be met by the employer or government is one of the idea to protect and be justice and non-maleficent on behalf of the healthcare provider. So poem by a Wuhan nurse on 2020 due this pandemic COVID-19. I am only performing my responsibility, being a lifesaver as a nurse. Often I had to stand at the front line without any protection, no choice of life or death, do not have any great thought. Please do not give me a rest, do not give me any applause, and not martyr or not or any merit. Coming over to Wuhan, not for receiving praise, just want to go back home safely after the epidemic. Even if it's just a skinny body left, I want to bring myself back to my children and my parents. And ask yourself, who is willing to hold your peers urn, making the way to home? So thank you, Dr. Ramesh.
Thank you, Dr. Hannan. Okay, so in conclusion, consideration of COVID-19 pandemic and its various ramifications continue, and with it, continued ethical dilemmas for healthcare professionals and decision makers at government and ministerial level. This open discussion has highlighted the pandemic ethical issues relating to cultural, political, and also social contexts and competing values and perspectives. We sincerely hope that this open discussion, starting from a Malaysian perspective, will highlight the need for a collaborative global approach towards the pandemic and ethical dilemmas it raises. As we all, as practicing healthcare professionals, there is a saying, we just want to go back home safely after the pandemic. So, in summary, this is our outline of contents which we actually discussed today evening, and these are our references. Thank you.
Thank you everyone.
Thank you.
Okay, thank you.